Howdy! Thanks for learning about MS with me, Aaron Boster. Cognitive impairments, or Cog Fog, affects over half of people impacted by MS, and it's invisible. Cognitive impairments can impact your ability to work through problems quickly, to deal with things under time pressure. It can make multitasking really challenging, and it can really ruin focus. In this video, we're going to talk about the biggest factors that can contribute to Cog Fog. I'm going to share with you ways that we can test and clarify Cog Fog, and importantly, I'll share 10 top tips, all research-backed, to help you improve your attention and cognition. Now don't turn away, because all of that starts right now. Cognitive impairments in multiple sclerosis are not remotely like Alzheimer's dementia. So someone with MS who experiences Cog Fog is not going to forget who they are or who someone else is or lose where they're located. That's not going to happen. Cognitive impairments in MS really impact what's called executive functioning. So this is the ability to lock on to a task, to attend. This is the ability to stay focused. This is the ability to multitask or to be able to deal with a cognitive problem under time pressure. Cognitive impairments in MS are actually related to disease activity. So people with MS who are more likely to experience Cog Fog are those that have very frequent MS attacks, those who have a high burden of disease on their MRI, meaning they have a lot of spots, and people with accelerated brain atrophy or brain volume loss. In other words, their brain is shrinking too quickly. Now, beyond MS, there's a bunch of other reasons that people impacted by MS can experience worsened cognition. So let's jump into a list of what they are. Let's review 7 factors that can exacerbate Cog Fog in MS. Number 1, and chief amongst them, is untreated or undertreated depression. People impacted by MS are twice as likely to experience a bout of depression compared to the general population. And if you're experiencing depression, you can have something called pseudo-dementia. Pseudo is Greek for similar to, but it ain't. Dementia means I'm not thinking clearly. And what happens is, in the setting of untreated or undertreated depression, the human being literally can't think as clearly. Now here's a pro tip. Depression is easily treatable. By treating depression, we can literally improve cognition. The second factor is poor sleep. Disordered sleep, things like insomnia or obstructive sleep apnea, make your brain run on empty. You're not refilling your cognitive reserve, so that's the backup energy your brain uses to deal with difficult situations. You're really starting your day off with nothing in the tank. Poor sleep massively contributes to Cog Fog. The third factor is MS fatigue. MS fatigue is unique because it doesn't go away with restful sleep. And again, it's one of the most common symptoms in MS. Now, fatigue and Cog Fog are tied together with a bow. And when you're exhausted from MS, it makes attending to a cognitive task much harder to pull off. As a pro tip, prioritize cognitively demanding tasks during times when you have the most energy, typically in the first half of your day. By being aware of fatigue, you can game out when you need to really put forth all of your cognitive thought so that you can perform better. The fourth factor is inactivity. A sedentary lifestyle is really harmful not just to your physical well-being, but also to your cognition. And there's good research to show that physical activity, being physically active, can help improve attention. It can improve memory and mental clarity. The fifth factor is poor diet. Diet plays a critical role in brain health. In a diet that's high in sugar, a diet that's high in ultra-processed foods, is really risking sapping your cognition. It can worsen attention and focus, and it can really diminish cognitive impairment. Moreover, spikes and crashes in blood sugar can really make you sluggish and not perform well. The sixth factor is polypharmacy, or being on too many medicines. Being on multiple medications at the same time can have several undesirable consequences, impairing cognition. Many of the symptomatic medicines used to treat people impacted by MS, such as bladder medicines, pain medicines, spasticity medicines, they can have negative consequences and they can really impair someone's energy and thinking. And the seventh factor is substance use. Recreational drugs and alcohol can have a negative impact on many aspects of thinking and memory. As a pro tip, I recommend moderation. decreasing alcohol intake, maybe reserving it for special occasions, and being wary of things like cannabis, which can help many symptoms in MS, but can certainly impair cognition. I'd now like to turn our attention to how do we assess cognition. If you're concerned about thinking and memory, I would recommend that you bring this to the attention of your MS provider. And there's a series of tests that can be done to help clarify if and what exactly is wrong with thinking and memory. My favorite screening test is something called the SDMT, or Symbol Digit Modality Test. This is a proprietary 90-second matching quiz. It can be easily administered in clinic visits, and in fact, at the Boster Center for MS, we administer this test at least twice a year. I would submit that it's the gold standard for screening for executive dysfunction in the setting of MS, and it can be tracked over time, making it super useful. I would submit that the next step might be having a somewhat formal evaluation by a speech pathologist. Speech pathologists that are kind of cousins of physical therapists are awesome at helping with swallowing, speaking, and helping with cognition. And a speech pathologist can run you through a battery of paper pencil tests to give us a much more robust understanding of difficulties with thinking and memory. The gold standard for understanding cognitive function is something called neuropsychometric testing. Now, this is the real deal Holyfield to understand the depth and breadth of cognition for a given individual. It's administered by a neuropsychologist. It's a paper pencil type test, and it can take several hours to administer. And it gives you really detailed information about how you fare in various aspects of thinking and memory compared to age and educational matched controls. In the reports that it provides, it'll share that these things you do a lot better than controls. These things you do on par, but unfortunately, these things you're not very good at. And we can look at the patterns to help best understand the issues that you're having with thinking and memory. This is a very powerful test, and I would submit that it's most powerful when it's repeated across time over every couple years. It also holds up in court and can be very valuable when trying to game out cognitive impairments as it relates to either educational efforts or issues in the workplace. Now let's review 10 strategies proven by science to help you boost brain power. These are tricks and tips that I recommend to families almost daily in clinic. The first one is to create habits and routines. For example, park your car in the exact same parking spot every single day. For example, place your keys in a designated spot each time when you get home. By creating these habits and patterns, you remove mental clutter, and you literally free up brain power. Number 2 is to use a notebook, or the modern version of a notebook, a smartphone app. Use it as a peripheral brain. Make lists of things that you need to do. Make questions for when you see the doctor. Use it to set reminders. This is a great way of helping keep you organized and on track and not forget important things that you need to be doing or important questions that you need to be asking. Number 3 is to exercise as part of your lifestyle. Exercise is super important if you want to live your best life despite having MS, for many different reasons. In this video, I want to highlight the fact that exercise literally improves cognitive functioning and slows brain volume loss. Now, as a pro tip, make sure that you don't hate the style of exercise that you're using. It needs to be fun. And when I say that I want you to do something as part of your lifestyle, that has a very specific meaning. Because doing something as part of your lifestyle means you're not rewarded when you do it and you're not punished when you don't. If you were planning on going for a walk Monday after work and the weather was bad, that's okay. Just wake up a little earlier on Tuesday and go for a walk before you go into work. No big deal. As a pro tip, we don't need to start off running marathons. On the contrary, I'm looking for 10 to 15 minutes of movement each day. That small exercise can really make a difference with cognition. So try it. Number 4 is to prioritize sleep. We need to be getting at least 7 hours of restorative sleep a night, and many red-blooded Americans simply aren't doing that. Now, sleep is a massively underappreciated brain booster, and if you're not getting restorative sleep, you're kind of chopping your cognitive legs off before you even start your day. If you have insomnia, or wake up multiple times a night to go to the bathroom, or wake up with spasms, or if you have untreated obstructive sleep apnea, get ye to the neurologist. Have them game out how to make those things better so that you can get your snooze on. As a pro tip, prioritize sleep hygiene. Set a proper sleep schedule. Turn the peripherals off a couple hours before you go to sleep. And if you have a big meeting coming up in the afternoon, try to sneak in a 20-minute power nap to recharge your battery. Sleep is underappreciated in a great way to boost cognition. Number 5 is to optimize your diet. I hate it when doctors say silly things like, what you eat doesn't matter, because it does. And it can play a major role in your cognitive reserve. I want you to seek out whole foods, single ingredient foods, and unprocessed or minimally processed foods. I want you to try to avoid sugar-laden foods, fried foods, fast foods. Importantly, I want you to avoid ultra-processed foods and any food that has an ingredient that you can't pronounce, because that's a chemical. I don't want you eating that. As a pro tip, plan out your meals. Do some cooking ahead of time on Sundays so that when you're in a hurry in the middle of your busy week, you can reach for something that's healthy. It'll make a really big difference in your thinking and memory. Try it out. Number 6 is to streamline your medications. Polypharmacy, which means you're taking way too many pills, can contribute to Cog Fog. And oftentimes I feel like doctors are pretty good at giving a medicine, but we're not very good at taking one away. Many of the medicines that we use to treat symptoms in MS are done for a very good reason, but they can have a side effect of sedation or Cog Fog. We need to think critically about medicines such as spasticity medicines, pain medicines, and bladder medicines, amongst others. Now, as a pro tip, when you go to your doctor's office, write down all your medications and their doses on a list and ask the doctor, is there anything on this list that we can remove or reduce? A second pro tip, when a doctor recommends that you start a new medicine, say, okay, doc, in exchange, is there one on the list that we can get rid of? Number 7 is a big one. Treat depression. People impacted by MS are twice as likely to experience depression compared to the general population, and undertreated depression can impact thinking and memory. It literally can cause something called pseudo-dementia, meaning that you're not thinking clearly, but it's actually being driven by undertreated depression. If we treat your depression, not only can that improve your outlook and your mood, but it can help you think more clearly. As a pro tip, I want you to have a very low threshold to go to your doctor and say, hey, I'm feeling sad, blue, and depressed. There are a host of things that can be done to treat that, including therapies and medicines. So don't let depression go untreated if you want to improve your thinking and memory. Number 8 is to practice daily mindfulness. Mindfulness is defined as being in the present moment without prejudice. In other words, you're doing an activity in the now and you're not at the same time worried about what's going to happen tomorrow at work. You're doing an activity now and you're not beating yourself up over something that you did yesterday. You're literally focused on the moment. Mindfulness takes lots of different forms. For example, walking in the woods, or doing a meditation or a breathing exercise. The reason this is so important is stress and anxiety can worsen cognition, and mindfulness can teach you a buffer to help manage your stress better. I'm asking you to practice mindfulness no more than 5 or 10 minutes every day, and you will cultivate a mechanism to manage stress, and by reducing that, improve your thinking and memory. Number 9 is to work with a speech pathologist. A speech pathologist can literally help you do cognitive rehabilitation. Think of it as physical therapy for your thinking. And they can help you come up with strategies and techniques and tips which are personalized to you. It's a great way of boosting cognition. As a pro tip, ask your MS neurologist to refer you to a speech pathologist for cog rehab. Work with them and see how it can improve your thinking and memory. Number 10 is to consider a stimulant medication. These can be massive game changers. I oftentimes remind my patients that when an airline pilot flies across the Atlantic, they'll give them a medicine like Provigil to keep them sharp and attentive so that they can do a good job flying the plane. We can use the same tools to help you optimize your workday and to think clearly throughout the day by taking a stimulant medicine. These can be things like Provigil and Nuvigil, or Adderall and Ritalin. They have side effects, and of course you need to work with your doctor to make sure that they're safe for you. As a pro tip, I don't ever recommend that patients take them 7 days out of 7. I always want you to take a 1 or 2 day a week drug holiday. The reason is that if you don't, I find that these medicines can sort of wear off in their benefit. And by taking a drug holiday, they can reset themselves. Stimulant medicines can make a massive difference in your cognitive performance. Talk to your neurologist about one. I want to hear from you. Which of these 10 tips are you going to try first? Building schedules and habits, or exercising as part of your lifestyle, endorsing mindfulness? Please leave your answer in the comment section below. Also, If you have a pro tip, something that you felt that has helped your thinking and memory, share it with us below, because I know that I and our other viewers would love to read what you have to say. If you want to up your game and learn more about MS, click the video that's on your screen right now. And until my next Monday morning video or my next live stream, be safe and take care.